Hello, good afternoon, everyone. Thank you for joining us to our first part in a four-part webinar series, Reclaiming Indigenous Sexual Health is Good Medicine, Indigenous Self-Determination is HIV Prevention. I'm going to ask our elder today, Linda Barkman, to open us up in a good way.
Miigwech. It's a beautiful day to be here on what we call Turtle Island. It's awesome just to wake up in the morning and to feel what's around you, much alone what you see and what you hear around you, but to feel what's around you and who's in front of you is more awesome than anybody can ever imagine, because you wake up and you see everything. You just fall in love again with the day because you know something's going to happen. So you fall in love every day, and that is Creator. I just need to say, Miigwech, for everyone that's here. Open our eyes so we can see the love and what is needed around and what is needed to say, be said with our mouths. Creator, give us kind words that will be listened to with our ears, because for that we hear with our ears, Creator, and Miigwech for that, and hear the good, the bad. But those are the things that we all need to hear, Creator. Miigwech for our mind, so that way we can process everything in the way that is being said and the way it's being meant, Creator. Miigwech for the beautiful day, for the people that are here, where we all walk the same journey towards the same goal, Creator. Miigwech, Miigwech, Miigwech.
Miigwech, Linda. Ani Bojo, Aaron Bauerman, Indigenous, Shegwenda First Nation, Minwatrana Donjaba. My name is Aaron Bauerman. I am an Anishinaabe two-spirit cisgender male. I'm from Shegwenda First Nation on Manitoulin Island, and I use he, him pronouns. It's a very exciting day. This is the first part of a four-part webinar series throughout the next year. And I would just like to thank our hosts, the Ontario Aboriginal HIV/AIDS Strategy, Two-Spirited People of the First Nations, and the Canadian AIDS Treatment Information Exchange. I'm going to be your MC for the next hour and a half, so I will stop talking now. And I would like to introduce the Executive Director, Megan Young, of the Ontario Aboriginal HIV/AIDS Strategy, and she's just going to give us a bit of how we got here, why we know that this conversation is important. Go ahead, Megan.
Miigwech, Aaron, Bojo Ginawea, Nigonsit Nindishnakas, Musquatasin and Dodem, Gitchawikadong and Donjiba, Anishinaabe Kwe, Mainwa Wasagadoi Kwe, Mainwa Shaganashi Kwe and Dao, Aurelia and Da. Good afternoon, everyone. It's so great to be here with you all. My English name is Megan. I'm from the Painted Turtle Clan. I grew up in Owen Sound, and I'm currently coming to you today from Barrie, but I live in Aurelia. I'm the Executive Director with the Ontario Aboriginal HIV/AIDS Strategy, and it's so great to be here with you all. I am so honored to be sharing this space with all of my fellow panelists here. We're in for a real treat. This webinar is really coming to you as a labor of love. We started the conversation for this webinar about a year ago. Oahas was partnering with CATIE as we engaged in all staff training in the 4 CATIE courses. And after the course that we had with CATIE around preventing the sexual transmission of HIV, we had some really great conversation, and some of the Oahas staff were asking questions around, but how do we actually support people that we're walking alongside to access PrEP? And what does this mean in community? And so that really started the conversation of looking at, for Indigenous peoples in Ontario, what are those pathways to access PrEP, and where is community knowledge around what PrEP is, what are some of the other HIV prevention technologies, and what is the willingness to engage in conversation and dialogue. And some of the feedback that we heard was that some of the PrEP campaigns that existed out there didn't really speak to community members, Indigenous community members. We didn't see ourselves reflected. We weren't sure why or how it might be relevant for us. And so this led to some larger conversation that I was really glad that we could talk to our partners at CATIE and talk to our partners at Two-Spirit Peoples of the First Nation to look and see what can we really do to increase knowledge and awareness and really set the tone to have some dialogue. And that's where we started talking about having a webinar. And so back in November, we were looking at, okay, could we get a webinar off the ground for December, and what would this mean? And then I was talking to some of our colleagues over at the Ontario First Nations HIV/AIDS Education Circle, or OFNHEC, and they asked me a really important question. If you're going to do a webinar, how are you indigenizing it? How are you making this messaging relevant for First Nations, Métis, and Inuit communities? And while we had some ideas about this, I really wanted to pause with that question and look at how are we really meaningfully engaging in this topic, and how are we growing deep roots and really situating it so it might resonate with community. And so that's when we decided to take a step back and really start planning where we would go from here and how we would host these conversations. And that's when the vision for a 4-part webinar series was born. So I'm really excited that we have this first part of the webinar series, which will really help situate the historical and current context of sexual health conversations in Indigenous communities, and really help us to understand where we've been and where we are today. And then as we journey on together over this next year, the second webinar will be focusing more on some of the biotechnological pieces, so we can have a better understanding of what does U equal U mean, what is PrEP, what is PEP, what is PIP, and so that we have a strong knowledge and understanding of what those mean and how they might be relevant for us. The third part of the webinar series will focus more on pathways and access. So how can we build that capacity within our own communities to really look at access? And then the fourth part of the webinar series will be looking more at how do we tailor messaging and address stigma in community, both in in-person workshops and some more innovation through online messaging, and what does that look like? So with that, I hope you all enjoy the session today. We really look forward to hearing your feedback. So please, please, please complete the survey at the end to share your thoughts with us of where we can go from here. And with that, I'll turn it back over to you, Aaron.
Me go to Megan. So I just wanted to go through what our agenda is going to be today. So we thank you, Linda, for opening us up in a good way. Megan, we all agree that this is a super important conversation, not something that happens very often. So we're really glad that you and the organizations have decided to do this type of work. So we're gonna have the four amazing panelists. Our first subject is going to be the context informing how Indigenous people learn about sexual health as it relates to HIV. Then we're going to have a conversation on the context and history informing how Indigenous people learn about sexual health as it relates to HIV. And our third piece is going to be the current context, barriers, and opportunities to increase access to HIV prevention, information, and services. We'll have an opportunity for questions and answers, and then Linda is going to close us off in a good way again. stop sharing. So being present and able to hear the sorrows and the joys of sexual health reclamation, we hope to engage in an important discussion that centers Indigenous peoples reclaiming our sexuality, our identity, all parts of ourselves as deeply connected to our well-being, and more specifically to HIV prevention. To talk about reclaiming means we will have to also take a moment to talk about what was taken away from us. Although we'll be honoring stories of pain and suffering in response to the harms of colonialism, we'll be doing it in a way that also honors our strength and is hopeful for what is yet to come. Still, some of these topics might bring up some difficult emotions. So we will be putting a list of resources in the chat, and then following this webinar series, we'll also be sending out everyone who registered a list of resources. And so we really encourage you, if you feel like you need those, to please access those. And that being said, we also encourage you to just do what you need to feel grounded and present in the conversation. Please consider what might help make you feel present and absorb more of the conversation. For me, I have a candle lit. I got my biche, my water. I also have some medicines and also laughing. You know, I'm hoping that today we're gonna have some really good conversations, and hopefully we can also have some fun doing this. We also want to remind everyone that we're trying to make this a safer, respectable space. So there will be zero tolerance for discrimination, stigma, racism, or homophobia. If this does happen, we're going to let you know that your comments are inappropriate, and we're going to ask you to refrain from that. If it continues, we will have to ask you to leave, and we will remove you from the conversation today. But this is a recorded session, and we encourage you to do follow up with us, to watch it at a later date. And if you have these, if you need more information, we encourage you to reach out to us and have a conversation, and we'll try to help you understand some different perspectives. And just a bit of housekeeping. So I'm sure we're all fairly familiar with Zoom, but at the bottom of your screen, we do have a chat section and a Q&A section. So the Q&A section will be for any questions that you would like us to ask. We will have a place at the end to ask questions, so we're hoping we'll be able to get to a few of those. And then we also have the chat section. So the chat section is just to encourage our fellow panelists, praise them and thank them for the work that they're doing and the stories that they're sharing today and being vulnerable. You know, there's some reactions, have fun with it, you know, enjoy it. And so with that, I guess today I just wanted to give a little bit of an overview on some of the objectives. So we really want to increase knowledge of how colonization and internal colonization prevent Indigenous people from fully benefiting from HIV prevention services and strategies. We also want to we're going to engage in a dialogue on the role of culturally safer approaches to sexual health and how it will help support Indigenous people to reclaim their sexuality. This is especially needed to enable informed decisions in our efforts to prevent the sexual transmission of HIV. So today we also have some guiding questions for our amazing panelists, and I'm going to take this opportunity to allow themselves to introduce themselves. So if you could all briefly take a moment, maybe let us know where you are on the land, what affiliations and identities that you hold, and anything else you'd like to share before we begin. So maybe I will ask Albert if you could go first.
Thank you, Aaron. Thank you, Elder Barkman, for your prayers, and thanks, Megan and Two Spirits Manitoba and Katie for bringing us here. I'm Albert Beck, and I'm actually in my homeland at the Red River Settlements in Winnipeg, Manitoba, and I identify as a Red River Métis citizen, and my pronouns are he, him, his. Thank you.
Thank you, Albert. Valerie, would you like to introduce yourself next?
Why, sure. Good afternoon. My name is Valerie Ajay. I'm from Edmonton First Nation, and I'm a co-lead coordinator for Nijag Alliance, which is a not-for-profit organization that services Two-Spirit LGBTQ youth in Ontario.
Welcome, Valerie. Teddy, would you like to introduce yourself?
Anim Bojo, Ajawan Queen Indigenous, Magana Dodam, Bajuan Donjaba. Hello, my name is Teddy. I'm coming to you live from the Robinson Huron Treaty Territory of Bawating and Sault Ste. Marie, right beside the Trans-Canada Highway. Fitting. I'm Two-Spirit and my pronouns are they and them. And I'm also gender fluid, but I've actually come to terms that I think I'm gender seasonal. So as soon as it gets warm enough to wear like those my skirts without leggings, then I just pull on the blouses and pull out the makeup. So yeah, more gender seasonal now and gender fluid. But miigwech, thank you.
Miigwech, Teddy. Andrew, would you like to go?
Anin Kinoea, we win a bojon into a maganadok, Nim Kibaneshi Indigenous cause, Wabajeshi and Dodem, Minawa Megaze and Dodem Eban Nimishal Misaban, Chimnissing in Donjaba and Switzerland Dinda in Gitchin and Mampi Benajan Nongwa. Hi everyone, my name's Andrew. You don't need to worry about the J, it's my first name, but never used it. I identify as a non-status First Nations person, a Gokwe person from the Anishinaabe collective with family and cultural ties to Christian Island First Nation. Worked for many years with Georgian Bay Native Friendship Center, and about 5 years ago, I jumped across the big waters and left my home community, and now I'm in the Indigenous territory of the Romanche in eastern Switzerland. That's me. Thank you for having me.
Miigwech, Andrew. Miigwech, everyone. That's super exciting. We're happy to have all of you here. And I guess we'll just get into it. So the first part of our conversation is on the context and history, informing how Indigenous people learn about sexual health as it relates to HIV. So I'm going to ask Teddy first. We know that a lot of your work involves sharing knowledge for people to connect history and culture to our relationship to sex and sexuality today. What do we need to know about the relationship Indigenous people have with sex?
I think that's a really good question. I feel like a lot of our cultural relationship with the sex and sexuality was definitely been erased over time through different aspects of colonial erasure and colonial violence. With you had two-spirited people who had, or different nations that had same-sex practices or had taken on a diverse look at sexuality. I guess you could look at it today. A lot of those viewpoints were frowned upon and looked upon that needed to be changed over time. So with my work, I've always started volunteering at a residential school gatherings here in Bawating at Algoma University, which used to be Shinwap Residential School. And those settings for myself was an opportunity for me to take a look into what it meant to be an Anishinaabe person, to be an Indigenous person, and how the impacts of colonization, specifically residential school, had on Indigenous people, Indigenous communities. Now, I volunteered there as a teenager when I was 16, and I continue to go back. There's going to be a gathering this year in the fall. And as I was going back there, I was able to listen to stories of those residential school survivors, but then also to think about as myself as a two-spirited person, it's like, what was it like for other two-spirited people? What did two-spirited people go to these schools? And then as I got older, many of the families were able to open up and share with me some of their experiences of two-spirited people that went to those schools and how their sexuality or their gender was corrected either really fastly, or the amount of abuse or pain or violence that they experienced was very high. And even so much so to hearing the stories of residential school survivors who came out as being two-spirit or LGBTQ, to me personally, and just knowing that how much that eraser had for them and how that homophobia and transphobia in the eraser of our ways when it comes to sexuality were taken away because of just the generations of residential school. because that's the one thing I tried to do within my own workshops, is trying to think about what was it like for Indigenous people over time? What was it like for LGBTQ people over time? What was it like for Two-Spirited people over time as well? So when it comes to residential schools, specifically, we're thinking about how those schools lasted for over 100+ years here in Canada, and that many of those schools were run by religions that still don't value being gender diverse, or having same-sex practices, or being sexually diverse today still. And that in Canada, that homosexuality wasn't decriminalized until 1969. So many of these institutions were valuing homophobia and transphobia at a time where our Indigenous people were also still losing our cultures, and still losing our ways of life, and still losing our children being sent to residential schools. So my questions now for communities and for people to think about is, how many of those children that went to residential schools were Two-Spirit or LGBTQ? And how many of those children who weren't Two-Spirit or LGBTQ picked up the values of homophobia and transphobia at those schools, and took it home, back home to their own communities, and shared that with their own children? And how many of their own children also went back to residential school, knowing that it was sometimes a generational thing for families to experience? Those questions can also be reflected when it comes to the scoop. How many of the children were part of the 60s, 70s, 80s scoop, or even the millennial scoop today? How many of them are Two-Spirit or LGBTQ, and how many of them are experiencing homophobia and transphobia in those places, whether it's their foster homes or group homes or what have you? So I think for myself, I was always trying to look at an intersectional lens, and what was it like for Indigenous people throughout history. The same thing with LGBTQ people, but also with racialized people as well, because again, depending on how you looked and how you sounded, your experience could be a lot different over time. So those are just the questions that I had, and I think I'm just going to finish too. It's just a question that I had with it was a circle that I was shared at York University with Lee Maracle, and this was many moons ago when I was living in Toronto. But they talked about how there needs to be more conversations about the difference or the nuances of how that sexual violence or sexual abuse is abnormal, or something that needs to be corrected, and that people who are LGBTQ or Two-Spirit are natural, and something that does not necessarily need to be fixed. It needs to be more understood and more respected and learned together with. So understanding that those nuances, that being LGBTQ does not necessarily mean as a negative thing, and going and having those conversations, and then figuring out what that language or terminology or those roles or ceremonies could have been from a historical point of view, that again were possibly or potentially lost throughout time. So I guess that's what I'll just have right now. I'll have a sip of my Starbucks. Thank you, Miigwech.
Miigwech, Teddy. Do you mind if I ask you another question? So in how Indigenous people relate to sex, have you seen any impacts in how we relate to accessing health services related to our sexuality and identity?
Definitely, I think that over time, for myself as a young Two-Spirited person, the words homosexual and gay were introduced to me by my peers, but also I was able to find in HIV/AIDS resource books as a child, and knowing that that as an Indigenous person, that the impact's probably going to be a little bit different, or a little bit more severe in some cases. So I think for myself, I was always looking out for those kind of resources that do exist. So I'm grateful and honored over this time to have worked with different organizations, including Oahas. Here locally, we had the Algoma AIDS Network that used to run the LGBTQ network. So it was one thing about building community, but we're also building our own awareness when it came to HIV and AIDS specifically. So the other opportunities that have developed over time here in this region, we've seen like opening doors conferences where people are coming together to share their experiences, that talk with service providers and healthcare providers to become more aware, because there's still a lot of stigma that is out there for folks, or even the lack of the resources that can be very specific from community to community. But other organizations, Megan had mentioned, like Often Hike, Ontario First Nation HIV/AIDS Education Circle. Had the privilege of working with them, especially working with youth in their communities across Ontario. Other organizations like in Toronto, Two Spirits of the First Nations, have been doing great work throughout the years, which I think a lot of folks, who, if they're impacted or even if they're looking for community, it's one of those flagship organizations that a lot of people hear about and go to. I know that was an organization that I was able to go to find resources when I was in college, and I was able to meet Tony Nobis there. And then speaking with them and saying, I was like, yeah, it's really hard for Two-Spirited people here in Sault Ste. Marie. He's like, well, here's this resource and here's this story, and let's figure out a way that we could get more information up there. So I think over time there's been a lot of growth when it comes to those organizations doing great work, such as like Anishinaabe Nation, NAN, and AIAI. But again, more information is keen. So I would love to see where this information can go. I think other resources that do exist to make sure we understand more of those stories are also important. So some resources that I share in workshops are including like the Red Rising magazine, that's their Two-Spirit edition. And then also working with service providers and educators and healthcare providers is the MMIW National Action Plan that was released last year. So again, it's great to see that there's more access and more availability, and but it would be great to see more of that happen elsewhere. So whether it's like pop-up workshops or tents, whether it's like a powwows or a pride event when it comes to learning about you equals you, or prep or pep or what have you, or even having or even attending the Two-Spirit International Gathering in 2018, where they had the public health officials out there, also providing information, and then also doing on-site testing for people who are interested in getting tested. So I think seeing more of that would definitely normalize getting more people aware about information that's available to them, just so that we know that it exists and that there's community for them.
Miigwech for that, Teddy. In my eyes, Teddy is a leader and a queen, and Two-Spirit and Indigenous queer. I think your insight and your humor has definitely changed the way I see myself and my community in the past few years since I've known you. So miigwech, Teddy. Albert, do you mind if I ask you a couple of questions?
Sure, I'm ready.
All right.
Thanks, Teddy.
So you've witnessed and participated in a lot of efforts to support Indigenous folks reclaiming their sexuality and have meaningful engagement in an HIV response. Our audience today is mainly made up of people who work within Indigenous communities and who serve Indigenous communities in a health setting. In the context of your own journey in HIV activism, what would you like them to take away from your experiences and what you've learned?
So these questions that you're asking, Aaron, are really, really important. And you know, I'm a person living with HIV for the past 30 years. I'm a 60 scoop survivor. I'm a family member with a missing loved one, and I'm an intergenerational survivor of residential schools. And all those are layered upon layer in the context of colonization, and with the loss of the knowledge of sexuality and gender expression within my community. And, you know, how we learn about our sexuality within the HIV movement was really, you know, very, very predominant in my experience as a person living with HIV. I didn't have the lessons or the teachings of being two-spirited, or even just, you know, looking at my body and understanding it, and understanding how I am to interact within my community, within my family, and within the mainstream society. And so it was an AIDS service organization that actually opened up my eyes to gender and sexuality. And it's been a journey for me in that context. And I think, you know, when we talk about, you know, sexuality and gender in our community, it's almost it's a taboo. And that has really impacted the response to HIV and AIDS within our own communities. And so, AIDS service organizations is that flashpoint where we finally learn about, who we are and the teachings that come behind that. And, some organizations do it well and some organizations don't do it well. But for those organizations that are doing it well, their ability to have meaningful engagement with Indigenous people of the different gender expression, sexuality, identity, really have this opportunity to be able to sort of engage and begin to instill those teachings. So for me, as a person living with HIV, in some ways I didn't know who I was. And so the AIDS service organization began to bring that information to me, in a way that allowed me to sort of explore and be able to sort of tap into the community where I run into many Two-Spirit people and gender diverse community members within the HIV movement, and of course, the broader community across the board. So, in accessing, our healthcare, for example, people that are, at risk or living with HIV and are expressing themselves in different ways, the healthcare system can be a very, unsafe space for those that want to access care and treatment. And so, it's important for, in my view, that those teachings, wherever you can get them, and like I said, and for me, it was in an AIDS service organization here in Manitoba. I just came home actually didn't come home yet. I wasn't even reconnected with my community, but I had told somebody at the men's HIV clinic here in Winnipeg that I thought I was an Indigenous. Well, I wasn't Indigenous, I was Aboriginal. And they said, "Oh, we know a place for you to go." So the community knew where, the community within Winnipeg knew where I needed to go. But had I experienced any sort of negative experiences within the healthcare system, I really don't think, for me, that wasn't my experience, because as a 60 Scoop survivor living in a non-Indigenous community, I was aware of the healthcare system, and I was very well versed in the pros and the engagement process. If someone wasn't giving me the proper care, I could go to a different second opinion. I could file a complaint and those different things. Whereas for many of others that are coming in from the northern communities, or that don't have, sort of access, or haven't had access, or haven't been involved in the healthcare system, they, really don't really know what the approach is, or what they're really entitled to, or even just the process. And when we go into the doctors, I go to doctors, I usually go on my own. But for my mom, for example, it's myself, my aunt, pretty much the whole family goes into the doctor's office now that we've versed the doctors, but it's usually family members that are going in to provide support, and so forth and so on. So for those of us that are HIV positive, that live in a different spectrum, that don't have those supports, don't have the teachings, it really puts our healthcare at risk because of the fact that we don't have that support. And so, and then sometimes we're teaching the doctors and the healthcare system about who we are, like what's Two-Spirit. I think I've had many conversations with my medical team over the years. Now they know who I am, and how fluid I can be some days where I'm at, depending on what season it is. I think how Teddy, how they put it out there, I love that. Depends on what day, depends on what kind of mood I'm in, is going to be what they're going to get that day. And so we're sitting there educating those from a non-binary approach, that it's whatever I'm feeling that day is going to be the day that I'm going to be expressing myself. And we're getting to the point where the binary narrative is really should not be non-existent anymore. We should be able to express ourselves as a human being in whatever way we want to express ourselves. That's just the way it is. So in the context of learning about sexuality and HIV, and getting access to care, we really need to be able to know who we are, what our roots are, how deep we are into Mother Earth, how connected we are within this space we're in. I'm at home in the Métis homeland. I work in the unceded, unsurrendered territory of the Anishinaabe people in Ottawa. But when I come home, I'm so rooted. In fact, I get my energy and I'm getting rebooted again, and I'm getting recharged. And it's so important for people to understand that, you know, even for a person living with HIV, your roots are where you're from. And when you transplant into a different community, that isn't your community, you know? So, you know, it's really important, you know, that you need to be able to sort of understand that and, you know, and support those that are coming into your community to access that. And the learning process is probably one of the key procedures. And I think the other thing is, you know, when we talk about aid service organizations or people providing services to gender and sexual diverse peoples in the HIV field, they really need to understand who their clients are. They really need to really honor those that are coming through the doors, that each person there has a specific story and experience. And, you know, I don't speak negatively about HIV in the context like, poor me and I got infected. But a lot of the people that are coming through that door that have experienced or are living with HIV have gone through some extraordinary traumas. And I'm not trying to put a level on that, but when they walk through that door, that's a miracle that they're walking through that door. And so, you know, they're looking for answers. It's not just care and treatment or supports, they're looking for answers. And I think, you know, aid service organizations need to be ready and should be ready. And some of them are, and like I said, some of them aren't. But when we start to talk about sexuality and those teachings that are really required, aid service organizations and agencies that are supporting those that are diverse and express themselves different, it's really important that you be able to set those teachings or opportunities for them to learn, because it continues to perpetuate itself in HIV, you know, and really it can continue to sort of have these negative spaces, because a lot of us that are coming through those doors are really dealing with identity issues and really need the knowledge or the confirmation knowledge of who we are. So I think that when we look at ways to you know, build relationships with Two-Spirit people, we really, the part of that process and those that are gender diverse and sexually identify sexuality and differently, we need to be able to build the trust. And so we have been able to do that. It's not a theoretical thing. We actually do that in some form or some others. And I think it's just really important that we sort of really try to create a lot of those relationships and building the trust with those, so that we can start to reconnect with who we are as individuals, no matter where we are on the spectrum of who we want in ways that we want to identify ourselves. So I think, you know, the work is there, it's going on. You know, many of us are starting to reclaim who we are. For me, I reclaimed who I was. I learned about being two-spirited. And that sort of created a bridge for me to reconnect to my community. And HIV to me has been a teacher. If it wasn't for HIV, I wouldn't know who I was, because I was really didn't have a path to go home, to reconnect with my community. But it was an aid service organization that helped me taught me about my sexuality, taught me to be proud of who I am, and taught me to be able to sort of put that into perspective in pretty much all the things that I do. So if it's taking my medications, if it's getting myself to the doctors, you know, part of our teachings is respect. So like if I make a commitment to go to a doctor's appointment, I need to go. That's me showing respect. And I'm also showing courage, because I'm going to go and take care of myself, and I'm going to have integrity, and I'm going to have those different teachings that I'm going to apply to every situation that I'm dealing with, including my own way that I identify myself sexually and my gender. So I think, advocacy for me and the work that I've been doing over the 30 years, I've been able to take that and package it in so many different ways, and the layers of the experiences that I've had to be able to sort of get that into perspective is really, has taken me a long time to sort of get that in place. And it's when I start to see things in the background as I'm going, got some years ahead of me to go, but I've got a lot behind me. I'm starting to realize how important that process was.
Miigwech, Albert. I have one more follow-up question. So you've seen things change throughout the years and you still carry so much passion, which is obvious. We're wondering if, you could speak to some of that. What inspires you today in the HIV response?
So this is a really great question, because I think we were kind of just talking about it today and sort of before this session started around, this is an exciting day to be able to come together to have these conversations. We didn't have this opportunity to have these conversations in the early part of the pandemic or the epidemic, the HIV movement. We really weren't really talking about it. We were just fighting to save our lives and to protect our community. And at one point I was young. I was that generation. I was part of that generation that was in the process, HIV movements and gay rights. We pounded the pavement, literally, demanding for action and demanding for, resources and demanding for different things to help fight and protect our people. I mean, I went I've done hundreds, I probably would say hundreds, I'm not gonna say thousands, of presentations in front of academia, in First Nations communities, in Métis communities, and Inuit communities. So I had all this energy and passion to get out there, to spread the word, to put myself out there, which, at that time wasn't really the most safest space to be able to do that. But I went out there and I did it because I knew it was important. I had to be a messenger. And those are the teachings I got from an AIDS service organization. It was important for me to get out there. I mean, my face was in the newspaper, on television. I didn't really think about my safety at that time. I was more thinking about other people's safety. But I was young and I had all kinds of energy. And I just believed that it was important for us to warn our community, to provide them the tools that they needed, and to really just go hard. And, I had nothing to really lose at that point in my belief system. In fact, it's my sexuality and gender identity that put me in a frame mind that as a two-spirit person, I have a responsibility to be that messenger and get it out. So, for me now, as I'm transitioning into, I'm going in that later part of my adulthood, and I'm sort of transitioning into, in the HIV world. I mean, maybe not right now, but in the HIV world, I've been doing this for 30 years. I'm not even supposed to be here. I'm literally was supposed to be gone. So for me, I'm sort of an elder in the sense of HIV, because there's not very many of us that have 30 plus years living with HIV. It wasn't meant to be. In fact, I remember when I was in 1995, I was diagnosed in 1992. In 1995, I was starting to die. I know what it's like to lose all your energy, and the feeling of death, was there. But I think, as I'm moving into the next phase of my life, it's my responsibility as an elder in my mind, to be able to transmit all the information, all the knowledge. And I think these are why these sessions are so important, is because for those of us that have been in the trenches for so many years and are still sort of working in different ways to educate our youth and those at risk of getting HIV, it's really incumbent on me as a two-spirit person to be able to transmit the knowledge that I have, so that information can go to the next generation. And I think that's really the message I need to, to convey to those that are participating and listening today, is that, there are those long-term survivors, and even if they're not long-term, they have knowledge to be able to transmit to the next generation, because it's you that needs to pick up the torch. And so for me, it's a symbolism that I pass the torch to the next generation, the Megans, the Aarons, the Teddies. I'm passing the information, and I'm passing the torch to you to take it on. And I will sit and I will guide if I need to. I'm here for you. I'm here for the community to be able to sort of take it on, because really we are in a space and a time right now where HIV is has come down a couple notches. Thank God Ontario has a strategy. Thank God, thank Creator, thank whoever, thank Megan, for continuing to fight to get the resources. Thanks to Spirit people, Manitoba, of Toronto. I think it's the next generation that's going to need to take this on. And as we fight for resources, the scarce resources, because we're coming out of another pandemic, which is COVID-19, HIV sort of taking a back seat, and we need to keep pushing our leaders, our governments, and even at the international level to ensure that HIV continues to be, because we're still in the middle of a pandemic. People don't seem to understand that HIV is still a pandemic after 30 years. We're still dealing with it. People are still getting infected. And so, part of the fight, or part of the work that needs to be done, is to continue moving that forward. So I think the next generation is got to take that on, and it's my responsibility, and those of us that have been doing it for many years, to pass that on. It's not a celebrity or a status thing, if people are going to put it in that context. It's just really about protecting the community and those that you love, and we're all family. So I think the message is to take this on. Those of us that have been around need to be able to pass that knowledge on. So I think I continue to have that passion. I always will have that passion, because I always think about how important it is to see a future where the HIV is no longer here. That's what's the driving force behind me. But in the interim, we take that HIV as knowledge, and as it pertains to our sexuality and gender, and how we learn about that within the HIV movement, is through the different teachings that you may get from those that have been around for a while.
Miigwech, Albert. We really appreciate all your stories and your vulnerability. I think I speak for all of us when I say thank you for everything you've done. You're a real trailblazer, and I hope that myself and this generation is ready for this challenge to pick up the work that you all started and are continue to doing. And so I hope that we can live up to what everyone else has done for our community, so that we could be doing this today. Miigwech, Albert.
You're welcome. Thank you.
So we're on to the second part of our conversation, where we're going to be speaking with Valerie. We're so glad she could join today. The second part of our webinar is a conversation on the current context, barriers, and opportunities to increase access to HIV prevention, information, and services. So Valerie, I know that you recently, we've seen such powerful work by organizations and initiatives that are led by Indigenous youth. We're so glad that you could be here today, and someone who's taking part in this work that Albert was speaking to. And so my question for you today is, as a young Indigenous woman in a unique position, you're from a fly-in community in Northern Ontario. Can you tell us more about how Indigenous people are currently accessing information and resources on sexual health, specifically how it relates to HIV prevention in your communities?
Hello, I'm like super nervous. It's been a while since I've done a speaking engagement like this. I know it's virtual, but so accessing like information and resources in Northern communities can be like a little like shamed or like embarrassing, because like the people, your family, they work at the nursing stations where you get this information. And like sometimes maybe you'll feel judged, or just like you just try to go grab condoms from like the free condom little bin, and like people are like, why are you grabbing condoms? But like it's better to be safe than sorry, right? But yeah, it's kind of like stigmatized up north because, like I said, you know, your family's working at the nursing station. They can see like you waiting there and they're like, oh, or they could see like your files. And it's just like, it makes you feel a bit like shy to like even just go to the nursing station when that's your only place to get tested or, you know, go for a regular checkup and just to make sure, you know, your body's healthy. Like for me personally, like, you know, like I would feel like a little shy because like, you know, my family is sitting right there at the front desk, right? But I noticed that like in urban settings, like it's less stigmatized, I guess you can say, because like, you know, people are more open about it and they're like, oh yeah, like here's a pamphlet. Whereas like back home, like it's just like, you know, like you're kind of like shy and like shamed, but you know, like people should not be ashamed to like, you know, go for a regular checkup or, you know, just getting information about different health services and resources that are provided. Yeah.
Miigwech. I have a couple more questions for you, if you don't mind. Wonderful. Have you seen any differences between how Indigenous people access this information or have a relationship to sexuality in your home community compared to an urban setting like where you live now?
Okay, so in terms of like getting like having a relationship with your sexuality, like I noticed like from where I'm from, like not a lot of people are open about it because, you know, they're like, oh, like ew, like, you know, like it's just like I said, like it's stigmatized. Whereas like in an urban setting, you know, people are like, oh, like I just got tested, I got a regular pap smear or whatever, you know. And like back home, it's just like, are you okay? Like, why are you doing that? But like, you know, it's just like, it's just to keep up with like being healthy and like, you know, being able to like not be ashamed anymore because like it's like 2022, you know, like things are changing and like I think communities like up north should move with the world, you know what I mean? But yeah, like a lot of like I don't think there was like a lot of like, from what I remember, like a lot of like info sessions about like HIV or like, you know, sexual health in my community. But like in urban settings or like different workplaces, you learn a lot more. So like I learned a lot more about like sexual health in urban settings than I did back home. Because like it's like, I don't know, it's just kind of weird because like it's like your family, your cousins, like it's just like a little, I don't know how to say like embarrassing, but like, you know, it's just like something you don't want people to know sometimes, right? Yeah.
Yeah, I think that's it also speaks to why it's so important to have, you know, organizations in northern communities doing this type of work and, you know, and young people doing this type of work, you know. Yeah, so I have if you're comfortable sharing, or if you have anything to add, what do you think why healthy conversations about sexuality are important in relation to HIV prevention work?
I think it's just knowledge that like every young person should know before getting like sexually active, you know, knowing the risks and like being safe and like, you know, having like prevention from catching like STIs and like all that stuff. Yeah, it's just like important knowledge because like a lot of like for myself, I didn't really learn a lot until I was like in my late teens. But I knew like, you know, and it could be different for everybody, right? But yeah, I think it's important to just like have this knowledge to be safe and like, you know, keep our kids healthy or like people, teens or whoever, you know, and just like stop being like the stigma against like sexuality because like it's who we are as humans. And there should be like no shame towards it. Like people should not be ashamed to go for a regular like checkup, you know?
I agree. I'm glad. So you shared a lot. I'm wondering if, you know, we talked about Indigenous people having these healthy conversations around sex and sexuality and prevention. So I'm wondering do you think that this generation is ready to have these conversations?
Oh yeah, definitely. I know on like TikTok, like there's a lot of like people like healthcare workers sharing information about sexual health. And like I think this generation is more self-aware than like, you know, back then because like like even like in different like parts, like, you know, sexuality and like all that stuff, like people are becoming more open and like, you know, wanting to be safe. So I think this generation is like totally ready to continue the work that Albert has been doing for years, you know. Yeah. And Nijayak, like my work at Nijayak, like we're pretty new still, but like we're hoping to do more work towards like, you know, healthy living and working with different organizations. Like we're still getting out there, but like we look forward to like continuing this conversation with everyone and, you know, sharing it with our peers and the youth and like just teaching them that like sexuality is okay. You know, like it's okay to like go get checked up. It's okay to just like, you know, just learn about like the risks and whatnot.
Miigwech, Valerie.
Yeah, thank you.
Well, if you're comfortable, maybe you could share Nijayak's Facebook page or something with other folks.
I could send a link in the chat. So if anyone wants to like look at our work and what we've been doing and keep up, and or if you're working for an organization and would like to like meet with us, like we could totally do that. I'll put our work email in the chat, and yeah, we can go from there.
Amazing. Miigwech. Well, thank you for sharing your very unique perspective on sexual health work. And I just wanted to, you know, mention like, you know, we are, you know, our goal today was to focus our conversations around people working in Indigenous communities, on reserve, off reserve, in healthcare settings. And so I think like you speaking to, you know, the on reserve healthcare settings, you know, sometimes they could have a, you know, family members working, or it could be that conversations are a little bit more few and far between. So I think like that's really important, that I hope anyone who's living or working on reserve like understands this, and we can help reduce the stigma and discrimination, and not shaming people for reaching out and trying to keep their health well. So yeah, I really appreciate that, Valerie. Miigwech. So we're on to our third section, and we'll be speaking to Andrew this time. Hello, Andrew. Thank you for joining.
Hello.
So this section of the conversation, we're going to be talking about how culture, self-determination, advocacy can be used to support culturally safer and empowering HIV prevention work. So Andrew, you've also been connected to this work for quite some time, both here in Ontario and in a broader context. Can you share your thoughts on how Indigenous people are reclaiming their sexuality, and why now is a great time to do this, especially as it relates to HIV prevention?
Well, I want to open up with, it's not necessarily that it's a great time, it's a necessary time, fundamentally. When I think about, I want to open up just for a moment, because we've been talking about the binary and gender and self-discovery and ways of reclaiming that. One of the first things that I want to open up with is the binary and gender as we see it enforced in our communities through heteronormativity is colonial violence. End point. And that colonial violence can be seen not only in communities in Canada, but within the US and in a broader global context. Stepping deeper into that, because of that heteronormativity, when you think about HIV prevention work or HIV care work, it's also rooted in homophobia historically, especially in our communities, as our communities have not always had access to healthcare, to knowledge, and have been impacted by so many different things that have created a thought frame that often creates fear, exclusion, and isolation of those of us who are on this call. And I think that there's many communities around the world who are responding to it in different ways. One example that I can think of is the Fa'afafine people in Samoa, which is a gender other than male or female, we'll word it this way. And in an external context, we would call them trans women, but culturally, that's not how they identify. But even in their communities, they have a role and a responsibility. And part of that role is people's health and well-being. When a tsunami hits Samoa, guess who's taking care of everybody? The Fa'afafine. Guess who's ensuring people are getting the HIV tests? Not only for queer people, but for everyone. That's that framework. And in the same way, when coming from an Anishinaabe perspective, I was a language teacher for many years. There's two words that we translate into English as man and woman. Kwe, woman, and nene, man. And yes, they translate into that, but there's a deeper context behind those that have nothing to do with our body and everything to do with our roles and responsibilities. There's other words for our bodies, and we're just beginning to reclaim that linguistically, culturally, ceremonially. And I think fundamentally, that reclamation is necessary. When I say what I'm about to say, first and foremost, to any people on the call on webinar who practices Christianity, this is not a shame at you, it's actually a shame at the church and its historic structure of causing harm. There's been a shame around sexuality, there's been a shame around difference, and there's been a shame around our heritage, our way of being, our way of living. And one of the things that's caused in situations such as HIV prevention, it's actually caused further transmission rates, not only in our communities, but in others. But most importantly, what it's prevented in many communities right now, and Valerie was speaking about how it's so difficult to go to your auntie at a health center or the nursing station to get tested. It's also that very auntie who believes that PrEP shouldn't be offered because you shouldn't be needing it, as an example. And I'm not saying that that's your auntie, Valerie, but I am saying that those aunties are there. This is a reality that when there are tools in spaces, oftentimes they're intentionally not accessible. And part of reclaiming who we are as Two-Spirit people, as Indigenous people, part of decolonization is access, is removing that shame, is removing that judgment. Albert, it was funny when you were talking earlier, because as you were talking about passing on to the next generation, as I realized that I'm no longer in that generation increasingly, because you age and suddenly you're 40 and you've been doing this for too many years, we'll word it that way. You were comfortable saying 30 years. I will say I've been doing this work for many years, at least 20, we'll word it that way. But it becomes this thing about how do you pass the torch? And one of the things that I think is fundamental for Two-Spirit people is we speak about intergenerational trauma and intergenerational violence as a result of residential school or as a result of the 60s scoop or etc. We're just beginning to talk about the intergenerational trauma between queer, Two-Spirit, and other Indigenous folks. And in many ways, when you think of intergenerational transmission of knowledge, that often occurs in a family home. It also occurs in this webinar right now. It also occurs in community settings, because not that you're that much older than me, Albert, but Albert would have been my elder, because he would have been walking around for at least 10 years longer than me in the context of an Indigenous Two-Spirit person living with HIV. And that knowledge could have been possible that God knows how many years ago. And in the same context, moving to Aaron or moving to Valerie or moving to Teddy or moving to others, we're just beginning to build mechanisms of intergenerational transmission. In that same context, one of the things that I also think is going on is because there's a lack of access to care, there's a lack of access to testing, and there's this stigma around doing it, or the shame, both on reserve, in flying communities and in urban settings, is new things that we know about HIV are not known by the general Indigenous public. I'm a person living with undetectable HIV. It's been undetectable since 2010. I'm in what we, as older people, I'm not sure if this term is still used, but I'm in a magnetic relationship, which means my partner's negative. We have chosen a number of months ago to stop using safety protocols because we don't need it. And yes, there's mechanisms, and yes, there's risks around that. But even having an open conversation that we as a couple have decided to do that, there's an inability to necessarily have that conversation publicly. And that conversation is around the knowledge of undetectable equals untransmittable. And in many ways, I'm very lucky because I live in Switzerland where that conversation started so many years ago. And I live in a country that doesn't criminalize my HIV status, but that's not a reality in Canada. And it's one of the primary realities that I'm here and not there. In the context of being a Canadian Indigenous person, things that I miss most when people ask me about Canada, pickerel and the powwow drum. Those are two things that I miss. And they're related to our communities, not the modern nation that we live in. But one of the things is here, you'll hear this concept of being a Canadian expat, because somehow when you come from Canada, you can't be a migrant. No, I'm a Canadian migrant to Switzerland for a variety of reasons. Does that mean I stop working with our communities? No, but it does mean that I'm in a different context. And so I do think that we need to find mechanisms to get those aunties to understand that, or aunties or uncles or community members to understand that regardless of their own opinions or shaming is about sexuality, PrEP and U equals U is healthcare. PEP is healthcare. Talking to your 14-year-old kid about your own sexuality is healthcare. I will disclose this way so that the one child that this is about doesn't kill me, because yeah, anyways, I've raised 5 foster kids. And what I will tell you is I will never forget the conversation that I had with a 14-year-old foster kid about the first time they had an orgasm by somebody else. You need to be able to raise your communities in spaces where that is possible. Anybody who's in Toronto, a woman named Maya Chakabi did some amazing language work a long time ago, really amazing language work. But what she did, I don't know, maybe it was about 2012, somewhere in there, she did a brochure with a whole bunch of terms in Ojibwe for sex. Ojibwe words for blowjob, for anal sex, for STIs, and guess what? We can talk about how elders are like, oh, we don't talk about that. But in the same way that an elder once said, oh, we don't have a word for tripod, for a camera. And then we're sitting in ceremony and this person is sitting on a 3-legged stool and she uses the word for tripod. We do have words for it. We just don't always think of it. And part of that is about engaging the right elders like Linda to have those conversations. It's really important. And yes, right now we're doing it on a webinar, but I think a fundamental part of HIV prevention in a Canadian context is the way we as a queer Indigenous collective, and I'm summarizing queer, I understand it's not a perfect word, especially for intersex folks. Intersex folks don't like the word queer, so I want to call that out. But I'm seeing it in other countries, and I'm often seeing it in island communities. I'm seeing it in Samoa, I'm seeing it in Tonga, I'm seeing it in those types of spaces, and it's profound. What I also think is I think very much within the concept of reclaiming our sexuality, being willing to have conversations about it as family members, as communities, talking about how sex is sacred. This conversation is often from the perspective of cisgendered, gay, lesbian, bisexual, straight people who don't necessarily have an experience of gender as fluid or as Teddy said, and I love that phrase, seasonal. And it's just amazing. And even within our own communities, if you present closer to the norm, somehow you have the privilege to speak. But oftentimes those people who present within the norm aren't the ones with the real knowledge of how to get into the deep roots of these things. And if we don't start empowering those who are pushing the envelope of our traditions and reclaiming the aspects of who we were as people from our colonizers, then we aren't really doing this work. And we need to push up those voices more and more. That's some of my initial thoughts around that.
美國change you. Lots to think about there. I have one follow-up question. You kind of spoke to it already. but what thoughts would you like to share with service providers to take with them after this webinar so they can feel more encouraged to start having these respectable and healthy conversations about sexual health?
I want to open up with they need to start talking in their communities, and they need to tell those who have a taboo about sexuality to get over it. And that sounds very harsh, but I'm going to word it that way. That part of what that is about saying that we need to carve out spaces that aren't being taken over. And we need to have that conversation that when somebody thinks something is taboo, part of that is also about colonial violence and about them living in a colonial structure, and that talking about sexuality is decolonial. We need to really push back this concept that there's generations of people who call things traditional in a specific way and who we are as modern people because we view things as two-spirit. Yes, we're taking a modern approach to something that existed a long time ago and that has existed for a while. We are traditional, we just aren't there traditional. And if you are in a healthcare setting, you need to begin to facilitate those conversations, and they are not going to be easy. And one of the key tools that I think that you could take in facilitating those conversations is actually restorative justice, because often people come from this shame and blame culture, where when you're dealing with restorative justice, you're opening up the question with who has been harmed and how has everybody been harmed. The second that you have those two questions asked, you've shifted the conversation and you've shifted into how do we work together regardless of our differences? Because that generation who thinks that we're taboo and shouldn't be having this conversation are going to be there. They're even in our own generation, and they are not a reason to not be doing this work. And one of the things that I think is fundamental in touching on this is that the conversations need to begin happening with youth again. I remember in the 90s as a youth, we were having many conversations. I worked as a volunteer at the Simcoe County AIDS Society, which is now the Gilbert Center. Way back when we had a youth theater troupe. And this was back when you were under 18, you could go around and teach others your age about sex, which was fun. And we used to do it through theater, and it was entertaining and interesting and processed. What I do know is that those conversations were happening back then in the 90s and maybe in the beginning 2000s, but in many ways they've slowed down or in many places stopped. And I think that we need to reclaim that conversational nature. And most important about that conversational nature is talking about how HIV has changed, because too many people in our communities are stuck in the knowledge that we had in the 80s and 90s. We are not in the 80s and 90s. As Valerie said earlier, it's 2022. There are so many resources to preventing transmission, to ensuring healthy life, living with HIV, and to ultimately reduce. I don't necessarily like the concept of eliminate, because again, it's this concept, it's there, and yes, it would be amazing to eliminate it. But I think the goal is more, how do we live in a healthy, integrated way without shame or taboo with those three letters in our communities?
Miigwech, Andrew. Yeah, you gave us a lot to think about. I do want to thank you as well for highlighting the important roles that transgendered and gender diverse people are also have played and are continue to playing in our communities. So I think that's I really appreciate that. Yeah, so that's all the questions I had for everyone. It was amazing conversation. I really appreciate it. I appreciate you being open and vulnerable. And yeah, from the bottom of my heart, I say Chimigwech. We do have a few questions that I will relay to the group if anyone would like to share a little bit further. We have a few minutes. So Andrew did speak to this, but I'm wondering if anyone else has any other thoughts they'd like to add. But how can we meaningfully move forward to address stigma in our communities? And anyone can answer. Linda and Megan, you're also welcome to share your thoughts.
Yeah, hi.
Ani?
Yeah, that's I like the way that you're talking, Andrew. That what I got out of it was, yeah, I got a bunch of stuff here, but anyways, I was writing, but I like the way that the way I looked at it was then, now, and when, right? Then was back then about how to tell you about this one journey of this lady that when she came out of residential school, as she had found out that she was HIV for quite a few years. But when she first started talking about it, about her sexuality, how it started was when she was about 4 or 5 years old. She was sexually abused by a neighbor. Her mother knew about it. Her mother walked in on it and kicked the guy out, of course, but also started spanking the little girl. The mother was a residential school survivor. Her parents were residential school survivor. So that is how she managed that. And what was going through the mother's head, I don't know, but that was what her first experience of telling somebody what had happened. So as further going down the line, things were happening to her, but she said that was her very first education about sex. She knew it was bad, but she knew it was worse when her mother started giving her heck for it, right? Started and you know, putting her to bed, go to bed, and that wasn't good for, but that was her first experience about it. So when she was growing up, she never told her parents anything about it because she knew it was going to happen. But still, with her parents being raised that way in residential school, well, that was how her parents knew how, I don't know, where we're stumped on how to teach them about sex, right? To talk about sex. That was, no, you don't talk about it at all. To show your shoulders. You don't want to show your shoulders. She was shamed about showing her body, like even having to wear shorts and stuff like that, right? So when she got older and she had her children, well, by that time she wasn't living in her community. She was out in the urban setting. So when she was growing up and trying to teach her children about sexuality, because she was going through from that time, age 4 to now, was a long travel. It was a long, lots of learning, relearning from what she had to learn from her parents. So now she's teaching her kids, talk about it. Don't hide away from it. It's not dirty, right? Sex can be the most beautiful, harmless thing in the whole world, right? But you got to know who you are first if you want to start traveling that journey, right? So that's what she's doing now, and I think it's the way she talks about it to her children is talk. A penis is a penis, a vagina is a vagina. Like you're saying, words for blowjobs, right? Be consistent and be right with the words. Is what she keeps telling me. So I try to be right with the words. Sometimes I'm a little shy, but I know I'm going to bust that door that I need to get out there to break the stigma, right? And that's where it starts, is the wording, like you were saying before. So yeah, I just wanted to share that and miigwech.
Miigwech, Linda.
I got nervous too.
Yeah. I have a thought. I also love hearing elders say blowjobs. We need more of that. I think one.
Yeah, the wording, that's what I was saying about the words. Yeah, you can't be shy about saying the
No.
words, and I'm busting that.
Love it. I think for myself, I think how I would see getting rid of stigma in our communities is really having those leaders in community who, like Linda, having that conversation and not being scared, or standing up when, you know, you might get, it might be frowned upon and people might not like what you're doing, but to continue that work, I think would be really important for myself in community. And then I think another way is just really acknowledging our own stigmas personally, everyone acknowledging how you see things, and really challenging those to educate yourself. I think that that's a good place to start individually, is acknowledging our own stigma and how we can change those perspectives.
No, this is just, Aaron, there's just thinking, made me think of like an open hike gathering where we're learning about safe sex, and there's a mix of youth and like elders, and there are like adults in the room too. And you can hear it's just like some of like the youth just like giggling about like some of those concepts or the words that they were learning. And then I think I looked over and I saw this one elder and they're like, oh, so that's what that's called. And I was just dying. There's like definitely like more opportunities for like intergenerational learning to have those conversations. Would be great too for like youth and for elders.
Mm-hmm. Mm-hmm. So we are at 1:20. I think that maybe we should start to wrap up. So I just wanted to summarize a few things that were said. You know, I'm not going to get it all, obviously, but Indigenous people reclaiming sex and sexual choices is good for our health. You know, there was a few other things that were said, that it's important for us to increase our knowledge of highly effective HIV prevention strategies, and yes, yeah. And it's apparent that ASOs play important roles in this movement, and it's important that they're well informed and caring and full of love. It was also mentioned meaningful engagement, so meaningful engagement with different communities, with people who are living with HIV, people from different demographics and different locations in the province. Healthcare settings, we want to try to encourage them to get rid of their stigmas and their shaming, and really encourage healthy conversations around sex. The importance of community and connection to all people, and access is really important. People do not know about a lot of these HIV prevention strategies or STI prevention strategies. So the more access we have to those, and the more able we're to self-determine how we take care of our sexual health. Oh, and the last one I had was sex is sacred. I think that's a pretty important one, as well. So I just wanted to talk to everyone and encourage you, if you haven't signed up. We haven't chosen a date for our second webinar. There will be 4 over the year, so we're really hoping that people will join us for those. The next one, we're going to be talking more addressing ways to prevent HIV in more detail. So those words like U equals U, PrEP and PEP, pre-exposure prophylaxis and post-exposure prophylaxis, and U equals U, undetectable equals untransmittable. We're going to dig deeper into what those are and how we can use those approaches and what's going on in community already. And so, yeah, we're hoping that you will join us for those. A few next steps of what's happening. So this session was recorded, and it will be available on CATIE's website within the next couple of days. And I believe it will be shared on social media, probably on Oahas's webpage and Facebook or social medias. There is also an evaluation, and I believe it will be emailed to everyone following this, unless someone just posted it in the chat. Yes, somebody just posted it in the chat. So we highly encourage you to take this survey for us. It's going to help. It's going to help influence what the next ones will be like. It may be similar, it may be different, and yeah. So we really appreciate any feedback you have there. And again, we have resources that we'll be sending out. They're also at the beginning of the chat. If you feel like you need any support in those ways, we definitely encourage you to reach out to those folks. And yeah, and I guess with that, we want to thank Oahas, Two-Spirited People of the First Nations, CATIE, and all our panelists. Without all of you, we couldn't be having this conversation today. And we hope that this is just the beginning of many more conversations within First Nations communities. So with that, I will say Chimigwech to everyone, and I will ask Linda to close us off in a good way.
Hi, I think we got about 5 minutes. Eh? I was just gonna ask if everybody has any water with them right now. I'd even if it's just from a bottle or whatever, that's fine. I know at the beginning, I usually do the smudging and stuff at the beginning, but I invite everybody that has water to dip your hand in there or pour a little on your palm of your hand. Then you smudge it around. You're gonna smudge your head, smudge your face, because like we said, water is sacred. Water is around. Mother, we use water to clean us from the inside out. And you're gonna smudge again, and you're gonna smudge the rest of your body. And as you're doing that, you're asking Creator, Miigwech Creator, for everything that we have. Miigwech for the things that we don't have, Creator. Miigwech for the eyes and the ears and my mind, so that way we can hold everything in. Miigwech for everything that we have and for the things that we don't have. Miigwech Creator for the loves we had in the past and the loves we have now and the loves we're gonna have in the future. Miigwech. But take your water and take a nice drink out of it. And as you're drinking it, you ask Creator, take everything that I don't need to have in me right now. Take it, because it's not mine to carry. And I would just like to say Miigwech for joining in. Miigwech Creator. Miigwech. Oh, Miigwech all. Just love this journey that we all walk alongside. Like I said before, we're all going to the same goal. Miigwech.
Bamampi.